my name is Danielle Curry. I'm a pelvic floor physical therapist here at Wasatch Physical Therapy. So pretty much specializing in male and female pelvic floor rehabilitation. And today I'm super excited to do my first ever Facebook Live to talk to you all about returning to exercise, specifically running postpartum. So pretty much it's a topic I'm super passionate about. I personally right now am 23 weeks pregnant, and I'm also a runner. So helping moms get back to the activity that they love, whether it's CrossFit, running, or they're trying to embark on a new activity or hobby after having a baby, is something that's super important. And so we want to be there as physical therapists to help moms return to those activities pain-free, leak-free, obviously, all those things. And so today, what we're really going to be talking about is the pelvic floor, what it kind of goes through as far as trauma during delivery, and then afterwards, kind of just that recovery stage. And we're going to look at 3 specific things that are important to kind of go through prior to returning to that activity. We would love interaction throughout this talk. And so if you have any questions that pop up or specific things you want to know, it'd be a great time to ask, and we'll definitely address those things. And we'll address some questions we got prior to our Facebook Live at the end as well. But so welcome, and we'll go ahead and get started. So the pelvic floor muscles, when you are looking at your pelvic floor. So these muscles are awesome, okay? Probably the most undervalued muscle in our body, in men and women, but especially in women. That's what we're gonna be talking about today. So the pelvic floor muscles after a vaginal delivery or during a vaginal delivery stretch to 200% of their maximum tissue elasticity, which is crazy. And so what we're focusing on is, just like any other orthopedic injury, let's take your ACL. We wouldn't necessarily start running with an ACL probably until about 12 to 16 weeks post-surgery. And so the same thing kind of goes for the pelvic floor. Most of the times you hear about your 6-week postpartum checkup, but why would we clear moms to start returning to whatever activity they're ready to do at 6 weeks when an ACL isn't even running until 16 weeks? So just like any other tissue in the body, your pelvic floor is a muscle. There's a ton of nerves in this area, and it's gone through that maximum amount of stretching, whether it's a vaginal delivery or even if you have a cesarean delivery. A lot of pelvic floor function comes from core control as well as hip and low back control. So with a cesarean, when those muscles are cut, then we're dealing with some abdominal wall dysfunction. And so we're really wanting to stabilize everything as a whole. So what we're going to look at today are some clinical practice guidelines, which pretty much are just evidence-based recommendations on some things to really check out prior to returning to exercise or running postpartum. These clinical practice guidelines were released in 2019 by 3 awesome physiotherapists, Tom Goon, Emma Brockwell, and then Grianne Donnelly. And pretty much what they looked at and what they discovered was the optimum time that these tissues, the muscles, the nerves, and everything heal is not until 4 to 6 months postpartum. So they really kind of discourage that returning to running prior to that 3-month mark. It's just too soon for most people. I'll clarify that. Everyone's different, everyone's individual, but for optimum function, we're wanting to wait until that 4 to 6 months postpartum. And so the 3 things we're going to look at today are pretty much seeing a pelvic floor therapist, so then your pelvic floor muscles and function is assessed first and foremost. Some load transfer tests, which I'll explain, but these are some tests that you can do yourself at home to kind of determine, am I ready to return to postpartum or to running and everything postpartum, and then some strength testing as well. You think about running and you think about that impact in that landing, or even something like jump roping, jumping jacks, box jumps. If you're a CrossFitter, enjoy that high impact activity. Those are all things that we hear often in clinic. You know, like moms leak with jump roping, they leak on the trampoline. It's that impact, right? And the reason because of that is when you land and you're impacting, it's 2 to 3 times your body weight when you're doing that impact. Now the pelvic floor takes the brunt of that. Being at the bottom of your pelvis, when you're landing, everything's kind of being pushed down, and that pelvic floor is responsible for stabilizing. Pretty much. So the first thing we talked about, we said we were going to assess pelvic floor function, right? And so what that is as pelvic floor physical therapists, what we're looking at is the overall function of the pelvic floor, okay? So the strength of that pelvic floor muscle, the endurance, so the ability of that muscle to hold a contraction, having a quick contraction, just like any other muscle in the body. You have muscle fibers that are responsible for either being a slow twitch endurance hold, or they're a fast twitch fiber. So if you're leaking with laughing, sneezing, coughing, those kinds of things, that fast twitch or that impact, fast twitch fibers. So we are assessed for that as well as overall breathing, abdominal wall function. You know, we talked about that cesarean scar, or we get a ton of questions about diastasis recti, which we'll touch on, but all of that plays a role in pelvic floor function. And so breathing does as well. If we have someone who, especially when you're returning to an activity that's going to increase your cardiovascular demand and you're going to be breathing heavier, if we're taking real short, shallow breaths, we're not getting the maximum movement and excursion through the pelvic floor. So that's another thing we look at as pelvic floor therapists. The ways we look at that are a digital vaginal examination. So we are able to and certified to assess the pelvic floor muscles vaginally. That's kind of the best way to get an idea of what's going on in the pelvic floor. Postpartum, you know, at your postpartum 6-week visit, you're often not getting that assessment from your OB. One, because they're concerned about other things, postpartum depression, baby, healing tissue, that kind of thing. But they're not really assessing the pelvic floor muscles, the strength, the endurance. Are they ready to return to that activity or sport? So that's what we as pelvic floor therapists are really focused on, is the overall function of the actual muscle. What we also look at is making sure there are no tender points or tight tissues within the pelvic wall, and then also making sure that you don't have any pre-existing conditions. You know, when we have moms who are wanting to come in and get back to running, if you already have a little bit of a prolapse or something going on, then we're really going to want to kind of modify things and monitor that as we're getting back into that run, or prior to that running activity. So that's the first thing we're really assessing for as far as pelvic floor function goes, kind of checking the list and making sure your strength is good, your endurance is good, you don't have any pre-existing things like you're already leaking or you're already prolapsing or something like that. Some risk factors for returning to running specifically or a high impact activity is going to be less than 3 months postpartum, as well as obesity, having a cesarean surgery. So if you did have to have a C-section, that's going to be kind of a determining factor as well, or having any perineal trauma. So if you did have a pretty severe perineal tear during your delivery or something, that might be a risk factor for returning to a high impact activity. And that's because we're really wanting to make sure those tissues are healed before returning to that activity. And then breastfeeding as well. So if you are still breastfeeding, you are still releasing a certain amount of hormones that are responsible for creating a little bit of more laxity still. So we're just wanting to monitor and make sure that you're ready for that higher impact activity. And then the last thing is if you already had some pain and issues during your pregnancy. So if you already had some pubic symphysis pain on that front pubic bone during back pain during your pregnancy, making sure that you're not having any of those symptoms with returning to your sport. Okay, so getting into what we're going to be looking at today. So these are kind of the symptoms that we're really watching for when we're returning back to that activity. So these are the things we're asking moms, okay? Because this is a classical sign of having abdominal wall or pelvic floor dysfunction with an activity. So if you are having any urinary or fecal incontinence, heaviness or pressure in the pelvic area or vaginally during your activity, lumbopelvic pain, so this just means pain in the hips, low back, pelvic area, or lower abdominal area during your activity, and then pain with intercourse as well. And so pretty much when we're going through these tests and measures, what we're really looking at is, you know, everything depends on, are you symptom free? So when we're going through these jumping activities and these tests that are loading the tissue and making sure you're able to withstand, what we're looking at is making sure, okay, did you leak with that? Or are you having any pain with that? Do you feel any pressure or cramping in your abdomen with that? So those are kind of the things we're going to be referring back to. All right. So our loading tests. So what this is, a load transfer test, is the ability for us to do an activity and to distribute the impact or the load of that activity evenly across your body, okay? And in this case, we're looking at evenly across the pelvic floor, the low back, the hips, and all the surrounding supporting musculature, and making sure that we're absorbing that correctly and we're able to take that impact. So what we're going to do, I have an awesome assistant with me. Her name's Kinsey, and she is going to demonstrate these activities for you, but I also will be talking out loud, and then I wrote them down for you guys so you could also jot note of, okay, this is what I can do at home. So like, let's try these things at home. Make sure that you can do these things, again, symptom-free, so no pain, pressure, or leaking with them. And then we can say, okay, now on to that next stage. So what we'll do, I'll put this here. Maybe I'll hold it. Okay. For you guys to still be able to see. Sorry. We'll change direction. Hold on. But Kinsey's going to kind of demonstrate this for us, okay? So first thing on the list is going to be a single leg balance test. All right. So what Kinsey's going to do is stand just on one leg for 10 seconds. Okay. So she's just going to hold that balance. What you're really looking for is if Kinsey were to really drop a hip or really be struggling with her balance. And as you can see, she does great with that. The next thing we'll do is we're going to do a single leg squat. Okay. What this is going to look like is Kinsey's going to stand on one leg, and then sticking the other leg out, she's going to gently squat down, tapping that heel and back up. You're going to do 10 of these on each leg. And then she'll turn towards the camera so you can kind of see a front view as well, doing that single leg squat. Perfect. Again, what we're looking for is making sure your knee isn't wobbling all over the place. Next is jogging in place for 1 minute. So Kinsey's going to jog, and when you do this over a duration of time, right? Super simple, just gentle jogging in place, again for 1 minute. And again, what we're looking for is, are you leaking? Do you have any pressure in the pelvic area or any pain when you're doing that? Okay, next thing we're going to do is a single leg hop in place. So 10 times on each leg, she's going to just gently hop. Perfect. Then what she's going to do is a single leg running man. So the running man's an awesome exercise working on balance as well as that hip control. And so she's going to go down and back up. She's going to do this 10 times on each leg. Beautiful. And then the last one is forward bounds. And so what forward bounds are is pretty much a repetitive jump landing on both feet. So she's jumping like that, and she's going to do it 10 times. Now ideally what we would do is we would do it a long ways, hopping across the screen, just like a cute little bunny rabbit. Perfect. But it's that forward leaping motion that we're really looking at. The last thing on their list for strength testing, or that load transfer testing, sorry, was walking for 30 minutes and making sure you can walk on a harder surface. So if you're going to be running on pavement, making sure that you can walk on pavement without any issue for 30 minutes, okay? So pretty much with the load transfer tests, everything that you're doing is 10 repetitions on each leg. Well, again, the load transfer tests are really mostly looking at the balance and the stabilization of all the tissues working together. Next thing is going to be your strength testing, okay? Now with the strength tests, we're doing 20 repetitions of each thing. Again, all of them single leg. So we'll have Kinsey again come demonstrate. The first thing Kinsey's gonna do is a single leg bridge. So she's gonna lie on her back with one foot up in the air, and then she's going to bridge up and back down. Again, you're gonna do 20 of these on each leg. So what we're looking for is, can you do all 20? Are you fatiguing before that point? Or does it look like you're starting to get really unstable? And does it look like you're starting to really struggle through doing this strength testing? Awesome, Kinsey. While you're on that mat there, go ahead and lay on your side. The next thing Kinsey's gonna do is sideline hip abduction. And so what this is raising that top leg and then back down. Again, doing 20 of these. This is a great exercise. It really works the glute med muscle, which is a super important muscle in hip stabilization and pelvic floor strength. So this is something that is super important, especially when you're returning to that high impact activity. So again, with these, you're gonna do 20 on each leg. The next thing Kinsey's gonna do is she's gonna do a single leg sit to stand. So finding a good surface to sit on. And then what you're going to do is sticking one leg out, you're going to go ahead and sit down and stand back up. Now ideally with this, you're doing them kind of as repetitions, right? Because we're working on strengthening. So it's almost more of a butt tap, back up kind of motion than a true like sit. And what we're looking for, and what you can kind of see in Kinsey, is the knee moving. And so that's what we're really assessing for, is can you do those repetitions 20 times again on each leg. The last thing for the strength test is going to be a single leg calf raise. So this is super important, especially with running, that impact and that load. So she's going to go ahead and with one leg off the ground, raise up on that calf. And again, you're doing 20 of these. And the point of this testing, guys, again, is to see your strength as well as balance. So when you're doing these, you're doing them pretty quick, back to back, to really kind of see your strength. And that's the strength testing. So thank you, Kinsey. Everyone wave and clap for Kinsey. So she passed, way to go. So again, strength testing, 20 repetitions of each of these things, all single leg activities, and all working super important muscles for that stabilization. All right, so we looked at the three things, right? We looked at your pelvic floor function first and foremost, the abdominal wall, diastasis, we've kind of cleared you on those things, and then you did your load transfer tests, making sure that you're distributing that weight and that impact well across your body without having any symptoms. Again, with those load transfer tests, you were doing 10 times of each of those things. And then your strength tests, again, testing the muscles that are most important for that return to impact, return to running specifically. And the strength test, you're doing 20 of each things. So hopefully you guys were able to take a screenshot of that, but we can also post it. So then we kind of look at, okay, well, what does it look like maybe recovering early postpartum? Because like we said, those tissues are optimized at 4 to 6 months postpartum. And so what we really want to make sure is, okay, that we're not just going to jump right back in. You know, a lot of times women, you know, especially if you're a runner beforehand, you were able to run 5 miles before or even during your pregnancy, kudos to you. But then afterwards, your first run postpartum at 6 weeks shouldn't be a 5-mile run. And so really what we're focusing on is let's gently kind of start to build that progression, load the tissues first in the appropriate way so we don't overload the body and the pelvic floor, and not returning to that high impact activity until 4 to 6 months, but listening to our body and starting with that gentle progression. So I wrote down just some general guidelines that were also posted in the clinical practical guidelines. But for example, like early postpartum in that 0 to 2 week time frame, maybe we're just starting with some gentle core, some transverse abdominis exercises, and some gentle pelvic floor contractions, aka Kegels, making sure we're able to do those things without pain and without discomfort. At 4 to 6 weeks, let's say, okay, we're going to start on some strengthening stuff. So we're going to do some squats, maybe you're gently holding baby, doing some squats or doing bridges, and some low impact exercise. So this can be a really good time to start getting out and doing some gentle walks around the neighborhood, maybe some spin classes or something like that. Again, low impact, but kind of gently starting to build back up. And then at 6 to 12 week mark, maybe then we start to really work on some resistance strengthening training. So doing some banded exercises for those hips with some of the exercises we just demonstrated, and slowly increasing your duration and intensity. So this is when, you know, with that first run postpartum, we would really encourage, let's say you were a runner beforehand, like being, you know, run a few minutes and then walk a few minutes, that kind of thing, and making sure over 10 to 20 minutes, you're able to do that run walk for a few minutes without having any symptoms, as opposed to just trying to run for 3 miles or something. So really kind of building up that intensity. This is probably where I see the most issues in clinic. I'll have moms come in, you know, a few months after baby, but then they'll be like, I'm trying to run, or I've had a few really awesome trail runners, but now they're having some pretty bad pain because we jumped into it a little too fast. Their intensity was way too much too quickly on the pelvic floor muscles, and now they're having some pelvic pain, some low back pain, that kind of issue as well. And so this is just some vague kind of guidelines, but we're going to touch on some questions that we got prior to our live, to kind of talk about maybe some specific things that we can do now. Okay, so one of the questions that we got early on was, you know, I've been leaking. My kid's 8 years old and I'm still leaking. Like, is it too late for me? And the answer is definitely no. It's never too late. And so what we as pelvic floor therapists are able to do is really kind of pick out, okay, where are our weaknesses right now? And let's strengthen those areas. And a lot of times we see just talking to mom about their breathing, pressure management, their hip strength, and then getting a really good isolated pelvic floor contraction. We've had great success with improving incontinence during running. So it's never too late. It's never normal to leak with an activity. And so I would definitely encourage you to take yourself through some of these loading transfer tests and strength tests, or find a pelvic floor therapist near you, and getting the help that you need to return to that activity. Another question that we got, that we get a ton, and I really think could be its own Facebook Live at some point, is some exercises for diastasis rectus abdominis postpartum. And so diastasis recti, as a lot of postpartum moms know, is the separation of your abdominal wall muscles. so that rectus abdominis, that six-pack muscle, when that tissue separates during pregnancy, that's actually normal to have a diastasis recti during pregnancy, but it's the afterwards that we can have issues. And so what we really look at is afterwards, when we're returning to exercise and returning to intensity, is what we call doming, okay? Or some people call it tenting. But what you look at is, say you're going to lie on your back and do like a little mini crunch, kind of head lift up. Is your abdomen nice and rounded, or are you having a little bit of a tent of that tissue when you do that activity? So one thing that is good to do is you can kind of test yourself lying flat on your back. You can put your hands right kind of at your umbilicus, right above or below, and then do a little head lift as you're lying on your back. Do you feel like you can press super deep? Or when you do that crunch, or say you're getting out of bed or you're doing a plank, are you having that doming and tenting? And that's what we're really more concerned about with diastasis rectus abdominis and healing that tissue. So I'm going to show you 2 or 3 exercises, maybe like my favorite ones, to kind of work on an earlier postpartum, but then we can encourage that afterwards. There's a ton that you can do for diastasis recti, but I'll show you my top 3 exercises for earlier postpartum. That way we're getting the good activation of the transverse abdominis muscle and really working on the pressure management to prevent that doming and that tenting. Pretty much what this means when you do have that doming and that tenting is that the activity is too hard for you. There's too much pressure in the abdomen, and that means there's too much pressure on the pelvic floor as well. So this is pretty much your body's way of saying, hey, this is a little too much, you know, let's kind of tone it back a little bit. So I'll have Kinsey demonstrate my top diastasis exercises for you guys. So what she's going to do, I'll move out of the way. Sorry, guys. Okay, she's going to get back on the mat or the bench. Let's do hands and knees. Okay. So on hands and knees, what Kinsey's going to do to start is just working on engaging that transverse abdominis in this position. Hands and knees is a great position early on postpartum. One, to work on your pelvic floor contraction and doing that Kegel, but also for that diastasis, because then that transverse abdominis is going to be against gravity, and we're working on lifting it up. So what Kinsey's going to do simply to start is just take a breath in, and then on her exhale, she's going to gently engage that transverse abdominis muscle. A cue we like to give for that is as you're exhaling and engaging that transverse abdominis muscle, physically think about blowing out a candle. That's something that can really help kind of lift that transverse abdominis muscle. Or thinking about your 2 front hip bones, kind of picturing those 2 hip bones like you're going to bring a string together. So as Kinsey's over there, I'll show you here. So your 2 front hip bones, well, we can picture that transverse abdominis muscle is coming down, and it's responsible for tensioning that linea alba, which is where you get that diastasis. So a lot of times we'll say, okay, exhale, gently think about bringing those 2 front hip bones together, maybe like you're putting on a pair of skinny jeans or you're blowing out that candle. So super simple. Just start with your breathing. Just start with that in. Is we're going to have Kinsey on exhale, lift opposite arm, opposite leg. So she's going to do that bird dog if you're familiar with that exercise. And then she's going to come back down, inhale, and then on her next exhale, she's going to lift. Perfect. Just like that. So that's another good exercise. Hands and knees is great for that early on diastasis. Now what we'll have Kinsey do, she's going to lie down on her back. All right, so on her back, what we're going to do is we're going to give Kinsey a tie here. So at home, she's going to hold it with both hands. And then what she's going to do is she's going to lower opposite arm, opposite leg as she exhales. So again, she's going to engage that TA muscle as she lowers and then comes back up, and then she's going to do the opposite. So ideally, you're exhaling, thinking about engaging that pelvic floor and that transverse abdominis muscle as you lower down. Early on postpartum, having a flat surface to practice on is what we want. The resistance band is a progression, so maybe to start, we're just lowering opposite arm, opposite leg like this. And then again, what you're looking for is making sure you're not having that doming of your abdomen when you're doing that activity. Perfect, thank you, Kinsey. The last great one to do is she's going to, again, hold the band here. And I'm throwing this on her all by surprise, so sorry. But what we're going to do, so say, you know, your other end is tied to a door or something like that. A great exercise, because this creates some tension in that linea alba, is she's just going to go ahead and exhale and lower one leg. Just like that, and then bringing it back up. And then she's going to do her other leg. So this is what I would start a mom on, making sure she's able to do that contraction, not tenting or doming. A really good progression of this, again, making sure you're not tenting or doming, is coming up into a tabletop position. And then again, now, same thing, she's lowering down that one leg and bringing it back up. So those are, I've lost count, maybe 4 great kind of transverse abdominis exercises. And again, the biggest thing, guys, is we're just really making sure that we're not tenting or doming as you're doing those things. But yeah. So thanks everyone for tuning in. It was so great to have you guys and see your interaction and everything. No further questions, right?
Nope, no questions.
Perfect. If you have any questions after the fact, don't feel afraid to shoot us a message or anything. And yeah, I'd encourage you all to try those load transfer and strength tests on you before you return to running. Again, 4 to 6 weeks postpartum is when those tissues are optimized. So best of luck in your postpartum journey.